Hi friends and subscribers, my name is Dr. Mayur Pai. I am a fertility specialist practicing in Goa in India. So in today's video, I will be teaching you and explaining to you basically how IVF process works. So let us begin with the preparation of the patient. Whenever the patient presents to us in the fertility clinic, we first do a diagnosis of the case. We always divide the couple into husband and wife separately, and we find out what are the problems we are dealing with as far as the husband is concerned and what are the problems that we are dealing with as far as the wife is concerned. So the husband usually undergoes a semen analysis, that is he goes to the semen lab, gives a small sample in a semen container, and that sample is analyzed. Very often we find some or the other issues in the sperm sample, or we find no issue in the sperm sample. If there is any issue, we treat it as per the different things. Now, just to give you a rough broad idea, in case there is a husband that is showing up with a low sperm count, any count above 40-50 million will give us a very excellent result. We find sometimes when the count goes below 30-20, that is when the couple may require something called an IUI or an insemination. We advise the couple as per that. And if the count goes below 20 million, let us say 15 million, 10 million, sometimes the couple requires IVF or ICSI, that is intracytoplasmic sperm injection, which is a special type of IVF for low sperm count to conceive. So this is just a basic broad idea of how the husband's tests are seen. Then as far as the woman is concerned, we try to diagnose what are the problems with the woman. We do two things in this case. One thing is a transvaginal ultrasound. Our fertility practitioner usually does the fertility ultrasound, which lets us know exactly what we are dealing with as far as the female anatomy is concerned. So in the transvaginal ultrasound, we see two broad things. One is how the uterus is doing. The uterus sometimes has certain tumors called adenomyosis or fibroids. Sometimes the shape and size of the uterus may not be normal. In such a case, what is to be done? We advise that. For example, if there are tumors called fibroids, she may require fibroid removal, that's a surgery. Sometimes there are things like adenomyosis which have different types of treatments. Let us say if at all the patient requires any surgery, whether the surgery will increase the fertility of the woman or not, this too is something that we speak about with the couple right at the beginning. So this fertility ultrasound is of paramount importance as far as the woman's fertility diagnosis goes. Then we also look at the woman's eggs. These eggs are stored in something called the ovary. Ovary is every woman has two ovaries, that's the right and the left ovary, and the quality and the quantity, roughly the quantity of the eggs in both of the ovaries is very important. So normally a woman in the reproductive age group would have at least 5 to 7 eggs per follicles per ovary. That is, the right will have 5 to 7 and the left will also have 5 to 7. So this is giving us a normal follicle count. Normal follicle count roughly indicates that the woman's eggs are going to behave in a normal way when we do the IVF. It is not necessary that every woman whose scan look normal will also perform normally, but usually a normal scan is a very good and a positive finding. Also, we look at any other diseases, like example any infection that may be occurring in and around the uterus or something like that, or there are any other tumors or masses which may be there inside the pelvis of the patient. All this is revealed by the ultrasound. Secondly, we do something called the blood work or the blood test for the woman. These blood tests are broadly classified as two types. One is what I call fertility or the hormonal assessment. Fertility or hormonal assessment is usually a hormone based test which will guide the treatment. One of the more important tests in these fertility tests is called the AMH. AMH stands for anti-Mullerian hormone. This is basically just like how we have a sperm count or a semen analysis for the male. This is also one of the important tests for the female. Whenever we do the AMH, we get a number. If the number, let us say, is less than 2, then usually we get slightly suboptimal results. If this test is more than 2, let us say 2, 3, 4, we get very satisfactory or optimal results from the person's IVF. Also, a low AMH indicates that this particular woman may require more than one egg retrieval cycle to produce very good results. So we can always give a patient a very good estimate of what the future of the fertility treatment looks like, whether one cycle is enough or 2 cycles are required, etc. We can also give her a very optimistic idea about how much time she may require to conceive, that is 3 months or 6 months, whether additional surgeries are required before or after the egg retrieval. All these things we can inform the patient well in advance. So one thing, the preparation stage or the pre-IVF checkup is very important to every couple. Once we have sorted this out, we come to know what is the drugs and the dosage that is required, and roughly we can estimate and give the couple a very good idea about the cost of the IVF. Usually in our center the cost is 1,50,000 Indian rupees, which encompasses the entire IVF package, that is right from the first day of the injectables up till all the baby making, including baby growing. This also encompasses the hospital fees, doctor's fees and everything, including the anesthesia on the day of the egg retrieval and the procedure itself, along with the consumables. So all these things is informed to the couple well in advance. Any deviation from the particular cost is also explained, which will be very easy for us to predict once we do this complete evaluation for the particular couple. Now the next step, once the couple has agreed to everything, the next step, which is very important, is called pre-IVF preparation. These may include certain medicines for the husband, and these may also include certain medicines for the wife. So depending on case to case, the medicines which are used, the tablets and the injectables that would be used from couple to couple in the pre-IVF stage differs. It is not that one size fits them all. We have to make sure what is correct for the particular couple is given to that particular couple. So after the initial testing and the groundwork, we give individualized medicines to the husband and the wife, and that's what improves the IVF success by, let us say, 5 to 10%. For example, some women may require oral contraceptive pills. Some people may require tablets of progesterone or tablets of estrogen, or a combination of them all, or some people require an injectable. All these things are used to enhance the woman's IVF success. Which is right for whom can only be predicted after doing their groundwork, that is the woman's checkup and the male checkup. There may be husbands who are having extremely poor sperm count, who require intracytoplasmic sperm injection along with the IVF to produce babies from their own sperm. These males also require a lot of groundwork, and they require a lot of pre-medication before the cycle begins in order to produce good babies from their own sperm. So these things are what I would classify as pre-IVF preparation stage. Now once everything is taken care of and the woman has her period, then IVF procedure, the proper IVF procedure begins. So how does this procedure begin? We inject, the main part of the IVF is the stimulation phase. Stimulation meaning the egg making stage. The woman's first step that we do is we produce her eggs, means they have the eggs inside, but we make sure that the eggs develop or mature the way we want them to mature. You must be knowing that every woman produces around 1 egg naturally every month. During IUI, that is in the basic insemination procedures, 1 or 2 eggs may be forced by tablets or injections to be produced per month. Whereas in IVF, we take the woman's eggs to the full power. Now what is this full power? we give gonadotropins. Gonadotropins are the natural substances which are produced by the human body, that's the woman's body, to produce eggs. We give these gonadotropins as injections. That means these are made in a factory and injected to the woman. So I'll just give you a demonstration. So this is, let us say, this is the syringe. This is a typical insulin syringe in which we load the injectable and we give to the particular woman. So this is what the woman will receive every single day. So you can see the needle is very thin, very tiny. It also hurts the woman very less. Our main intention is to make sure that the entire process is as painless or as much pain free and comfortable as we can make it. So the woman receives this one particular or two injections daily. Why one or two? Why can't we have one type for all? It again depends on the woman's profile. There are women who require a single injection throughout the cycle. There are women who compulsorily require 2 injectables per day, every day, for making the good quality eggs. So women are different, their ovaries are different, and the response to treatment is different. Again, treatment is individualized. Now, at this stage, another very important thing is the woman presents on the second day of the cycle. Every woman requires 10 to 12 days of these injections to make sure that their eggs reach from the 0 size to the complete or the mature size. So every woman's ultrasound is done on day 2, that is the second day of her menses, and we start giving the injectables as per the individualized requirement for that particular woman. Every day these injections are given for 10 to 12 days. Once the 10th and the 12th or the 12th day is reached, the ultrasound is done, which documents that the woman's eggs have become mature or ripe. Once the woman's eggs have fully matured, that is the day when we give a special injection. Again, same size, but the drug or the medicine is different. It is called the trigger shot. The trigger injection is the injection that produces the final maturity of the egg and makes sure that the eggs are ripe for egg extraction. So now going to the next step, that is the egg retrieval or the egg extraction. This is usually done on the 12th or the 14th day of the patient, of the woman's cycle. Depending on woman to woman, some will have the retrieval day on day 12, some will have on 13, some would have on 14. Few women may have it beyond day 14, but that is as per the woman's requirements. So this day is predicted, as I told you, by ultrasound, that is a transvaginal ultrasound. And before the retrieval takes place, we give a trigger shot, which may again be 1 or 2 or 3 different types of injections as per the need of the patient. After giving this shot, roughly after 35 hours of giving the injection, we do the egg retrieval. On the day of egg retrieval, the woman is admitted roughly around 4 hours prior to the retrieval stage. She is usually expected to come to the hospital fasting, that is after almost 6 to 8 hours of fasting. After that, she is admitted and given a room to stay happily along with her husband. At just around half an hour before the appointed time of retrieval, we get the patient for preparation inside the fertility operation theatre. At that moment, we do all the things required to make sure that the woman is very comfortable and does not feel any pain or discomfort from the procedure. Usually, the egg retrieval procedure is done under mini anesthesia, either a short spinal anesthesia or a short general anesthesia. In a general anesthesia, the patient's whole body is sleeping, whereas in spinal, it is half the anesthesia, means below the umbilical level, the woman will not be feeling anything, but she would be conscious. What type of anesthesia is best for the patient is always discussed by the couple with the anesthesiologist, who is the anesthesia giving specialist. So once we have given whichever type of anesthesia is the correct anesthesia for that particular woman, the patient is very comfortable and pain free. We do this procedure of egg retrieval transvaginally. What we do is we do the transvaginal ultrasound that is traditionally done. Along with that, we slide a small thin needle inside through the vagina directly into the ovaries. This is done under ultrasound guidance. This means that the needle directly enters into the follicle where the egg resides. We suck all the contents of the follicle, which includes the eggs, and this is done throughout the ovary into each and every follicle. So let us say the woman is producing around 10 to 15 follicles in that particular month, then all the 10 to 15 follicles will be aspirated out with the prayer that each follicle contains an egg. Roughly, we notice that 70% of the follicles which are aspirated would contain an egg. We also estimate that roughly around 70% of the eggs that are retrieved are mature. These eggs which are mature are then given the sperm of the husband. This process is called fertilization. So this fertilization step is a crucial step in IVF, which is not there in insemination or any basic treatment. I will go into it at a later stage. So all that process is taken care of on the same day as egg retrieval. Now, from a patient's perspective, how is the patient going to feel this egg retrieval procedure? Patient only feels the anesthesia part of it. Mostly 70 to 80% of the women go for a complete anesthesia, that is a full body anesthesia, which makes the patient unaware of the entire procedure, unaware of the pain or any sort of discomfort of the procedure. Also, the recovery from the procedure is very quick. You will be noticing through this video that the egg retrieval itself takes roughly around 10 to 20 minutes max to max. If the number of follicles are less, it will take lesser time. But for a good stimulation for a woman who is young and has good enough number of follicles, 10 to 20 minutes is all that it takes to finish this entire procedure of egg retrieval. Once this is done, the patient is sent to the recovery room where she recovers very quickly. Most women gain complete consciousness within a few minutes and are able to walk, go to the bathroom and have some sips of water or any juice within the next 1 or 2 hours. Also, after 1 or 2 hours, most patients are so comfortable that they can be safely and happily discharged to their home. These patients can also join work immediately the next day or within a few hours of doing this procedure. This procedure during modern times has become very, very safe, and it is very comfortable for the woman to go do her work immediately after this procedure. No requirement for any bed rest for the next few days or leave from home, etc., etc. The patient just resumes her normal day-to-day activities. So this is the complete idea about the egg retrieval process. Now comes the process of fertilization. This is done inside the fertility or the IVF lab. It is done by us and the patient is not required for this. So remember, just now we have retrieved the woman's eggs and now we have also received the sperm sample from the husband. Now, depending on case to case, there are women who have husbands with very good count who may undergo traditional IVF. So what is this traditional IVF? Traditional or classical IVF means the woman's eggs and the sperms are kept together in a very small space. Here the sperms enter the egg naturally, just like they would have done inside the fallopian tube. We do not force fertilize the egg. To a large extent, roughly 50% of the cases that I do are done this way. This is a very natural way to go ahead, and the fittest sperm is chosen by Mother Nature. So this is a very good way and a world standard of going ahead with IVF. Many a times we find that very good quality babies are produced from classical IVF. So this is one of the ways of fertilization. For this, a very important factor is if the age of the woman is little bit young and the sperms are of good quality. Sometimes when the eggs are a little bit more aged, we have to force fertilize them using this process called ICSI. Now what happens in ICSI? ICSI is the other type of IVF in which we have an egg and we take the husband's sperm in a micro needle and we inject it inside. This force fertilizes the egg and makes sure that the sperm enters and fertilizes the eggs right before our eyes. Also, another reason for doing this ICSI is the husband having extremely poor sperm count or poor sperm parameters. This ICSI is also done in women who have undergone previous failed traditional or classical IVF, or we have done a classical IVF on them and we have found that the fertilization rate is very poor. So such people are the right type of people for ICSI. Whether to do the IVF or whether to do the ICSI, leave the question to us, leave the decision to us. We are well qualified in making the correct decision on your behalf. So all these things are always discussed in the preparation stage with the patient, and the couple's understanding of the entire procedure plays a major role in the decision making. So here I have told you about the fertilization. Now the next step is the embryo development or the baby development. Once fertilization happens on the first day of, that is the day 0 or the egg retrieval day. So what happens after fertilization is that the baby grows. Every day we find that the number of cells in the baby keep on increasing. They have to increase in size and they have to increase in number. Basically the embryo has to grow in size and the cells have to increase in number. So all this thing is always taken care of by the embryology team. This baby is seen under a microscope periodically when the right time is there, and we document the size of the embryo and we also document the number of cells that the embryo has. Normal growth indicates that the baby has extremely good prognosis, means there is a very high rate of pregnancy from that particular baby. We grow the baby for roughly 3 to 5 days. Almost 70% of the patient that we grow the baby up till day 5. That is called the blastocyst stage. On day 5, we usually see that the babies have attained a very good size and the babies look very strong, and only the strong babies can be inserted into the woman. So also another very important advantage of IVF over things like IUI is this fertilization and the embryo development stage. Usually whenever a patient comes to us with failed IUI or failed insemination history, one thing that they keep asking is, why did they not conceive? Now, as far as IUI is concerned, we do not know at what stage that process went ahead embryologically. Did the sperm and egg combine? Did the sperm and egg combine and go ahead and then stop? Or did the baby form to a certain extent and then the formed baby collapsed? All these things cannot be answered in a case of IUI. Whereas in a case of IVF, whenever we do the fertilization, we see the growth of the baby. If the baby is not growing beyond a certain stage, we know that there is a trouble as far as the sperm or the egg is concerned. If the growth goes beyond a certain stage, we know that the baby is of high enough quality to be given back to the couple. All these things can only and only be seen during a case of IVF and cannot be seen during IUI or insemination. So these are the two great differentiating factors as far as basic treatments are concerned and IVF is concerned. Many a times we have a couple in whom we see that the egg and sperm, they look very good, but sometimes whenever we put the sperm inside the egg, the babies that are made are not of optimal quality for conception. So if the problem lies with the egg or the problem lies with the sperm, we deal with it as per that individually, means every couple gets an individualized solution to their problems. So this is as far as the embryo development is concerned. Once healthy babies are produced, that is the time when these healthy babies have to be given to the mother or the woman. So now what happens is, if at all we find, so usually what we do is we sometimes do some hormonal blood studies in the woman. These studies are done usually just near the egg maturity stage, either on day 10 or day 12, depending on case to case. These hormonal studies give us a very good idea about the hormonal imbalance in the particular woman. If at all these blood tests say that there is imbalance, or there is a chance that this particular cycle, if at all we do this studies and we find that it is not a very good idea to insert the baby into the woman in that particular month, we do what is called embryo freezing. So these are certain things that we discuss with the couple right at the start, that there may be a small chance that they may require embryo freezing. So what are these indications for embryo freezing? Let me also discuss and educate you in this particular video. Sometimes the progesterone level goes high beyond a certain acceptable limit. When this happens, we say that it's a very good reason to do embryo freezing. Mostly 99 to 100% of the women that undergo polycystic ovary IVF in our hospital, we do freezing for them. This is always done to prevent something called ovarian hyperstimulation syndrome. So this is something which is very compulsory in PCO patients. So usually whenever a polycystic ovary or a PCO patient undergoes IVF, mostly they will not get the baby inserted in the same month. The babies will compulsorily undergo freezing, and this baby will have to be transferred inside in a later month. Again, if at all the woman is a case of low sperm count, in case the woman is a case of low egg count, this is when we may go for multiple stimulations. We may also do something called a double stimulation or a dual stimulation. These are all cases in which we have to compulsorily do baby freezing. So freezing, which is technically in the medical language called embryo vitrification. This is a process when we put certain medicines into the we dip the baby inside certain medicines. These are very, very safe and well studied medicines. These do not affect the baby, and these medicines, the baby along with these medicines is put inside liquid nitrogen. This baby is cryopreserved or preserved for a very, very long time. We have been doing this for very, very long time, and it's a very, very safe way, and lakhs and lakhs worth of babies have been already frozen throughout the world and utilized in this particular way. So embryo freezing is a very safe way. This is what I want to convey through this video. Okay. The other thing is the woman's blood test may come out to be quite normal. That means that there is absolutely no hormonal imbalance in the blood reports that we do, and we can transfer the baby in the same cycle. So this particular process either takes place, that is the embryo transfer process takes place on day 3, or it may take place on day 5. So depending on that, we take the baby, we put it inside what is called a transfer catheter, and we inject it directly into the womb of the mother, exactly where the implantation has to take place. So this is one this is called a fresh transfer. The other one, the frozen thing, is called the remote embryo transfer or frozen embryo transfer. So both of these are valid ways of transferring the baby, depending again on woman to woman. Once the woman is pregnant, we take care of the woman for 3 to 4 months. If the patient is referred from another center, we send the patient back to whichever center the patient has come from, or in case the patient comes directly to us, we take care of the pregnancy and deliver the woman. So after this video, after I finish this particular video, I will also be showing you an egg retrieval process and how that process takes place. I hope you enjoyed this small video session that we have. In case there are any questions, do write in the comment section. Thank you. So friends, here is a case where I am doing the egg retrieval in a patient. Patient is already under anesthesia, and the patient is not feeling any of this procedure that is going on. So on the screen you can see that there is a small needle that is being used. This needle is a very thin needle which has been put inside which has been inserted directly into the ovary of the patient. You can see the black color balls that you are seeing on the screen. These are follicles of the patient, and overall you can see that almost all the follicles are mature. There are hardly any follicles which are small. So this is one advantage where IVF scores over these basic treatments, because in basic treatments what happens is the smaller follicles are not used or usable in fertility, whereas over here in IVF almost all the big follicles that you are seeing, these are used for the baby making process. The prayer is that every follicle that we are aspirating has one egg inside, and as I told you that roughly 70% of these follicles would have some egg inside. 70% of all these eggs which are retrieved are mature and potentially can be combined with the sperm or fertilized with the sperm to make babies. So over here you can see on the screen that as we aspirate the liquid out from the water balloon or the follicle, it becomes smaller. So we have to make sure that we are doing a good job inserting the needle exactly or very close to the center of the black ball. We are aspirating all the liquid from that. Everything is a precise and well coordinated process. Since we have been doing this for years together, we know exactly how to do it precisely and very quickly. So you can see this is the the right ovary of the patient that we are aspirating the follicles from. Just after every follicle is aspirated, we change the direction of the scan and we go and aspirate from the next follicle. So remember, this patient is fully comfortable and anesthetized and she is not feeling any of this. Also, this particular patient has come to the hospital for a few hours worth of admission and she is not going to stay the whole day. Patient has been admitted just 1 or 2 hours or 3 or 4 hours depending on when they would like to come into the hospital to stay. After the procedure, again 1 or 2 hours, patient is fully comfortable walking around, having sips of water or juice, and can be discharged to their home very much within a few hours. So all these patients don't take leave, or they take a half day leave from their work and they are working the very next day. So this egg aspiration or the egg retrieval process roughly occurs on the day 10, on the day 12 or day 14 of the cycle. It is before this process happens, two things which are done. If you had seen my video prior to this, two things which are done. One thing is that the patient is given a trigger shot, which is an injection which causes final maturation of all these follicles. And the second thing which is done is we do a special blood test which will tell us whether the woman is having elevated progesterone levels or not. If the woman has elevated progesterone levels, then we cannot do a fresh transfer of baby inside this woman, and in case she is having normal hormonal levels, then we can transfer freshly into this particular patient. So over here you must have counted very close to 10 or more follicles have been removed out. And you can also see majority of the follicles that you are seeing on the screen are mature. There are very few number of, definitely there are, but very few number of immature or tinier follicles. Here you will see that I am going a little slow and careful because we are very close to the blood vessels. So these are the last two follicles in the ovary, I believe. And this you can see, after we have aspirated the follicles, the size of the ovary has reduced quite a bit. Here these are the last two follicles of the patient. That's one, and one more last to go. Though you will see the one just beyond the needle also looks like a follicle, that's a big blood vessel and we should stay away from it. With experience we know exactly what to poke and what not to poke. And there you can see that on the entire ovaries all follicles are retrieved. There you go. Yeah, now that ovary is surely taken care of. Now this is the other ovary of the patient. Every patient may have ovaries of different sizes. Like in this particular patient, you would realize that this ovary is slightly smaller than the previous one, and it has slightly lesser number of follicles as compared to the first one, though it has many. Here you see a follicle that is unusually large. This may or may not have eggs, but we have many of them who are sufficiently normal in size. So most probably we are going to get a good number of eggs from this particular case. So there again you can see the follicle like structure on the right side of the needle is actually a blood vessel. There you can see we have almost reached the end of the egg retrieval. Hardly a few follicles are left. The moment we aspirate all these things, all these follicles side by side, the embryology team is taking care of the fluid that we have aspirated out. It is sent to the embryology lab, which is just a few steps behind my back. There all these different the fluid or the water which is coming out from the follicles is checked for good quality eggs. Whichever eggs are found will immediately after a few minutes or a few hours be combined with the husband's sperm, and the baby making process will begin from that very moment. So you can see that it's a team effort, and it's not that one person can do this entire thing, because it requires many hands.